Thank you, AMSC, for giving me an opportunity to share with you my experience in caring for patients with chronic illness. Regardless of the specialty you're in, we all need to care for patients with chronic diseases. These chronic conditions include asthma, diabetes, cancer, chronic kidney disease, etc. According to the Australian Bureau of Statistics, almost half of the population were estimated to have at least one or more chronic conditions. With our aging populations, we have more patients with multiple comorbidities requiring medical attention. Being a nephrologist, I'll use chronic kidney disease as the focus of my talk. CKD is a major public health problem. 1 in 10 Australian adults has CKD, but less than 10% of these people are aware that they have the condition. The risk of CKD increases rapidly with age, with diabetes being the leading cause of CKD. Take, for example, diabetic nephropathy. I see these patients when they are first diagnosed with microalbuminuria, while their renal function is still normal. Over time, they develop more micro and macrovascular complications. Their renal function slowly declines, and down the track, they'll end up on dialysis or require a kidney transplant. The time for this whole journey varies. Some take 5 years, some take 30 years, depending on a lot of different factors. With intense medical research and clinical experience, we have a better understanding of the natural history of the disease. Medical school and specialist training equipped us with knowledge on the most updated treatment for diseases. We give dietary advice. We prescribe the drugs like ACE inhibitors, ARBs, SGLT2 inhibitors, tell them to exercise and lose weight. But is that enough? There was one Friday afternoon. I just really want to be relaxing on the beach and not think about work at all. Read a book and basically just chill. Yet I'm stuck in a busy clinic. Patients after patients talking about low potassium diet, fluid restrictions, convincing people that they need to lose weight, they need dialysis. And towards the end of the clinic came this 60-year-old man, John. He was 2 hours late for his appointment. John is a long-term patient of mine with CKD, secondary to diabetes and hypertension. He was lost to follow-up for a year. He had no idea why he needs to be in my clinic, except he knows his GP was worried about him. Well, I guess it's good. At least he responded to his GP's worries. I thought I did all the right things. I told him about diabetic nephropathy, educated him about lifestyle modification, reminded him he needs regular blood tests, gave him pamphlets, talked to his family, and here he is, 1 year and 2 hours late for his appointment, and asking me why does he need to be sitting in front of me? What should I do? What can I do? Have you had similar patients like John? Do you ever have a feeling that we walk with the patients through the journey of chronic illnesses, but it almost feels like we're walking on different roads, even different directions? No matter how much you explain in that 15 to 30 minutes consultation time, nothing seems to register in their brain. You almost wish there's a USB port and you can just download the information to their brain instantly. Then I had a light bulb moment. Even though John speaks and understands English, we're not talking the right health language. What does CKD mean to him? What does protein in the urine means to him? As health professionals, When we talk about CKD, we think about risk associated with morbidity and mortality when not treated early. For John, it's just a label, as he feels perfectly fine with no symptoms. We prescribe medications because it reduces proteinuria and have significant cardiovascular and mortality benefits. For John, it's a waste of time with no significant benefits that he can tell. With or without medications, his life goes on. Diet is important, as hyperkalemia can cause sudden death. What did John tell me? It's my life. I eat what I like. What about dialysis? Oh, please don't go there. Tell me when I'm 80. So, no, we're completely not on the same page, not on the same road. John taught me about empathy. I learned to look into his world through his eyes. John was very quiet throughout the consultation until I asked him why was he late for the appointment. Then suddenly he opened up, telling me all about his grandson. He was late because he was watching his grandson perform at school. His life was all about his grandson. All he wanted was to watch his grandson grow, get married, have a good life. What about CKD? I then put CKD into his context, telling him how CKD can eventually affect his life and he won't be able to see his grandson grow. Then we started walking on the same road. Being a doctor is like being a life coach. We can't just label the patient with a disease and only focus on the treatment for that particular disease. Treating chronic diseases involves setting long-term goals for patients to achieve, changing the mindset of the patients in order to change their lifestyle, and motivating them along the journey. It is a marathon, not a sprint. Over the years, I used 5 steps to walk with my CKD patients on the same road and help them stay focused on the journey. We set clear goals together. I get them to visualize their success, start a to-do list, review treatment progress regularly, and we celebrate little wins. Why is it important to set goals for treatment? CKD patients remain asymptomatic until their GFR drops till, say, 20, and that's too late to start treatment. Setting goals with measurable outcomes give patients direction and help them focus on what is important to them. And like I said, doctors and patients think differently. A recent published paper on cancer patients showed that patients and oncologists have a very different goal for treatment they receive or prescribe. Their concordance rate was as low as 24%. Treatment goals varies according to patients' educational level, age, religious views, and performance status. Take John, for example. His goal is to watch his grandson grow, and so his grandson's performance or school activities will always be a priority in his life. It is therefore not surprising that he missed all the follow-up appointments with me. This highlights the importance to set goals with patients, taking into account their life. I get patients to visualize their success with treatment. Visualize the day that they're healthy enough to watch their first grandson born, travel around the world, watch their grandkids get married. It is important to stay motivated. After all, it's a very long journey. As you may know, apart from medications to reduce proteinuria or lower blood pressure, a lot of the CKD treatment involve lifestyle modification. I do give my patients homework and ask them to put on their to-do list. One of the major homework is exercise. Studies have shown that moderate physical activities improve morbidity and mortality related to diabetes. It can induce neurohumoral, vascular, and structural adaptations to lower blood pressure. But have you thought about why patients never achieve their goal of exercising 30 minutes a day, 5 days a week? Think about going from not exercising at all for more than 30 years. And now you ask your 50-year-old patient to exercise. I can assure you he will feel as if he had a heart attack after running for 2 minutes. My strategy for obese patients in particular is to start exercising 2 minutes a day, any kind of exercise, every morning, 2 minutes, just to get them to build up a habit of exercising before they go to work, every single day. They can't argue with me when I just ask them to do 2 minutes a day. Once they manage to do 2 minutes a day, they get really motivated. It becomes more realistic. Slowly increase the time to 5 minutes, 10 minutes, with the goal of reaching a regular 30 minutes exercise daily. This is much more realistic and achievable compared to just jumping straight from no exercise at all to 30 minutes exercise. The next thing you do with patients is reviewing their progress. Blood tests, urine tests, give us a good indicator of whether a treatment works. Say with proteinuria, their urine ACR will drop if their blood pressure control is better. I also ask my patients to write down the days if they've done their homework, like exercise on the calendar. Through the review, you will help the patients to identify any challenges that they encounter. Say if their blood pressure or potassium is still high after they try altering their diet, bring in the dietitian review at this time will be easier for the patient to take in the advice from the dietitian. Always remember to celebrate the little successes with patients along the journey. As I said, it is a marathon. They will lose motivation at times. Little hiccups will appear. But if they keep their goal in mind and remain positive, they're more likely to be compliant with all the treatment you suggest. I hope my experience inspires you to also walk confidently together with your patients on their journey of chronic illness. I'm Christina. Thank you for listening. Please feel free to email me if you have any comments or questions.